Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College, and also principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, August 29th, 2022. And today I'm going to provide an overview and update of the current status of COVID-19 vaccines and boosters. I will then provide an update on the new COVID-19 Omicron boosters developed by both Pfizer, BioNTech, and Moderna that will be available in the coming weeks. And also we'll talk about the new COVID booster developed by NovaVax. I then will provide an update on the Johnson & Johnson vaccine. I will then conclude by providing an update on COVID-19 cases, hospitalizations, and death, both nationally and in Tennessee. Existing approved COVID-19 vaccines in the United States were developed by Pfizer, BioNTech, Moderna, and Johnson & Johnson, and are approved either as a primary series or as a booster. All persons 6 months of age and above in the United States currently are eligible for a two-shot primary series of an mRNA vaccine developed by either Pfizer, BioNTech, or Moderna. The second dose of the Pfizer, BioNTech vaccine should be taken 3 to 8 weeks after the first dose, while the second dose of the Moderna primary series should be taken 4 to 8 weeks after the first dose. In addition, a two-dose primary series of the NovaVax vaccine is to be taken 3 weeks apart and has been approved by the Centers for Disease Control and Prevention for individuals 12 years of age and older. The previously approved vaccine from Johnson & Johnson is no longer recommended by the Centers for Disease Control and Prevention and does not have a booster. In addition, all persons 6 months of age and older are eligible to take a third COVID vaccine, also referred to as a booster. The third dose or first booster should be administered at least 5 months after the second dose and may be either Moderna or Pfizer, BioNTech, regardless of the dose taken in the primary series. Anyone who has not received that booster should do so as soon as possible. 2 weeks ago, NovaVax submitted for an early EUA to the FDA of its booster, which can be administered regardless of the primary series that was taken. The NovaVax vaccine is a bivalent protein-based COVID-19 vaccine adjuvanted for active immunization to prevent COVID-19 as a homologous and heterologous booster in adults ages 18 and above. The NovaVax booster currently is being reviewed by the Food and Drug Administration but has not yet been approved. Both Moderna and Pfizer BioNTech offer a second booster that is only authorized for adults 50 years of age and above, or for persons under 50 who are immunocompromised. The fourth dose should be administered at least 4 months after the third dose or first booster. Rather than approve the second dose for persons under 50, the CDC has waited for the newly retooled COVID vaccine boosters, which were formulated for the Omicron variant. Existing COVID vaccines were based on the version of the virus SARS-CoV-2 that emerged in Wuhan, China in late 2019 and are a poor match for current Omicron strains. To address this gap, the United States plans to roll out an updated COVID-19 booster vaccine that includes Omicron subvariants of the coronavirus in September 2022. Both Pfizer with partner BioNTech and Moderna have completed applications this past week to the U.S. Food and Drug Administration for their respective COVID vaccine boosters retooled to target versions of the Omicron variant of the virus. The new retooled vaccines will be bivalent and target both the currently dominant BA4, BA5 Omicron subvariants and the original version of the virus. The FDA is expected to review and authorize the updated vaccine boosters this week. The government plans to open the Omicron boosters to people from age 12 and above. People over 50 and those who are immunocompromised or at high risk are those who are most likely to benefit from these new boosters. The CDC's Advisory Committee on Immunization Practices, or the ACIP, has scheduled a two-day meeting of its expert advisors on September 1st and 2nd, a step that typically follows FDA authorization. If the FDA authorizes the updated vaccines this work and the ACIP approves the recommendations in early September, the retooled COVID boosters could both become available in early to mid-September. Now, nationally, the coronavirus cases and hospitalizations have both fallen steadily through the month of August. The average number of cases announced each day is an undercount since many cases go unreported, but it has shown significant progress in recent weeks. The count of new cases now sits just above 90,000 per day, down from more than 130,000 per day in mid-July. Cases are falling in all but 8 states. And some states, primarily in the West, have seen cases decline by 30% or more in the past 2 weeks. Hospitalizations have seen similar improvements. Fewer than 40,000 people are currently in American hospitals with the coronavirus, a decrease of 10% since the start of the month. The number of virus deaths announced each day has been fairly flat in recent weeks, at less than 400 or 500 per day, far lower than at most points in the pandemic. Unlike most states, COVID cases have been trending down. Tennessee has experienced a 70% increase in new reported cases over the past 2 weeks to 4,223 per day, and now leads the nation in new cases of COVID-19 per 100,000 of the population. While both hospitalizations and deaths in Tennessee are both down slightly over the past 2 weeks, they are lagging indicators of new cases and can be expected to increase sharply in coming weeks. Test positivity in Tennessee continues at 27%, which is the third highest rate of any state in the country. The percent of persons who are fully vaccinated remains at 55% for the 11th straight weeks. 36 counties in Tennessee are now in the CDC's red zone, up from 32 2 weeks ago, and only 2 counties in the past 2 weeks were in the green zone, including Shelby County in West Tennessee, down from 16 counties 2 weeks ago. The remaining 57 counties are in the yellow zone, up from 47 counties 2 weeks ago. There are 4 clusters, each with a minimum of 6 adjoining counties in the state, one in the west, a second in central Tennessee, a third in southeastern Tennessee along the border, and a fourth in the far northeastern region of Tennessee. Counties in the red zone include Nashville, Davidson County for about the 10th straight week, and Chattanooga County, or Chattanooga, which is in Hamilton County. People who live in the red zone are advised by the CDC to wear masks in crowded indoor spaces, conduct activities outdoors when possible, or maximize ventilation if you need to be indoors. There are several suspected factors that likely are contributing to the recent surge in new cases in Tennessee. First, schools have just reopened, and this is a likely driving factor of new cases. If this is the case, we can expect to see similar trends in other states that start schools later than Tennessee. Second, hardly anyone is wearing masks anymore, even in crowded indoor spaces. The combination of increased contacts indoors, i.e., schools reopening, and the high transmissibility of Omicron is a likely scenario. While most counties follow a predictive surge or a pattern of surges and return to a lower level in about 3 weeks, Nashville Davidson County continues to buck this trend. Nashville-Davidson County has been in the red zone for about 11 consecutive weeks. This is likely due to its centrality as a party destination where there's little regard to COVID precautions. Breakthrough cases are becoming the norm rather than the exception. Many people who have previously had COVID or been vaccinated are now getting COVID a second or third time. While COVID-19 is no longer seen as a life-threatening disease for most, it remains a very serious illness for persons over 70 and for those who are immunocompromised or have other serious health conditions. Persons over 70 continue to make up the majority of persons who die from COVID-19. In addition, long COVID appears to be affecting 25 to 35% of those who get it. Getting COVID multiple times may increase your risk of getting long COVID. So if you are vulnerable to COVID or live or work or visit persons who are, and or you succumb to long COVID, your behaviors may put yourself and others at risk of severe health outcomes. For now, this is Dr. Paul Juarez from the Tennessee SEAL, wishing you a good day.